It is with immense pleasure that I welcome two from the front line surgeons' voices for the ACS Bulletin Brief, Dr. Chris Ellison. Dr. Ellison is chair of the ACS Foundation. Welcome, Dr. Ellison.
Thank you, Dr. Wexner. It's a pleasure to join you.
Well, you and I have worked together over the years in many capacities on boards, the American Board of Colorectal Surgery and on the Board of Regents, but now I have the opportunity to see you in action as the chair of the Foundation Board, and I'm impressed by the work of the Foundation, want to share that work with the rest of the fellowship. Perhaps you could start by giving us a sketch of approximately when the Foundation began and its purpose, the mission for which it was created.
Well, I think it's important to realize that the Foundation's been in existence for about 15 years, and it was established basically to support the missions solely of the American College of Surgeons, the fellows, and colleagues that interact with the college. From the international perspective in particular. So I think that the Foundation purpose is to support activities that cannot otherwise be supported through college revenues.
So in order to support the programs, clearly revenues have to be raised. You mentioned that word, revenues. What are the various sources of revenue with which the Foundation can make awards?
Well, there are two, basically. There are individual contributions of the fellows, and then there are corporate contributions. The individual contributions make up about a third to a half, depending on the year, of the donations, and the corporate contributions the other portion. The individual contributions are divided into those that are restricted. That is, the donor names a specific fund for those dollars to support. For example, Operation Giving Back, Stop the Bleed program, the Barbara Bass Global Scholarship Program. These are specific items that an individual could list when they make the donation, and those monies then are restricted to that activity. And about 2/3 of the donations, particularly in this past year, were restricted, named by the donor. The other portion are unrestricted funds, and those funds are basically used to support the greatest needs of the college in terms of the scholarship programs or other programs and initiatives to meet the mission of the College of Surgeons. And then the other category is the corporate sponsors, and corporate sponsors fund resident skill competition, skill training at the college meeting, and patient education resources. For example, colostomy education resources for patients who have a colostomy following colon resection is provided through the ACS Foundation with industry support.
Thanks very much. How would one go about applying for support from the ACS Foundation?
There are specific applications and processes that I believe are available on the website, and the individual can apply for research scholarship, for example, of which there are several given each year, or a traveling scholarship to travel to various meetings of the College of Surgeons. And this supports individuals coming from rural areas, for example, in the United States, or from international areas, particularly those in low or middle income countries.
Thanks. You mentioned a few of these particular grants that are directed, donor directed. So you have the Barbara Bass grant, and you mentioned Operation Giving Back and Stop the Bleed. Are there any projects specifically that come to mind that are individual from the unrestricted funds for which people have applied and then gone on to have successful delivery of their grant application purposes, as it were?
Well, I think several individuals come to mind for the ACS Research Fellowship. So first, I think Henri Ford was a recipient of ACS Research Scholarship, and it really ignited his career. And certainly now being a regent and the chair of the program committee, somehow was probably related to that initial research grant. I think that others would include Carrie Sims, who received a research award from the college investigating domestic violence and how to detect that in the emergency department, and others. And these, are people that have incredible capabilities and skill, but they need to get a start. And I think that's what the ACS Research Scholarship does. It allows people to begin their careers and jumpstart them so they can go on to develop more full research and academic programs. I think one of the other impressive programs is the Dramati's Family Travel Fund. And the Dramati's family was recently recognized by the foundation as the Philanthropist of the Year for FY20 in March of this year. And they fund individuals from the Philippines to come to the United States annually to attend the American College of Surgeons meeting. And this has been going on for a number of years. And this year, this past year, one or two people came from the Philippines on that traveling scholarship.
Excellent. You mentioned coming to the U.S. for the annual clinical congress, which of course isn't happening, as we know from the virtual background behind you, that there's a virtual meeting ongoing, and hopefully lots of people from the Philippines are amongst the, I think, close to 30,000 registrants for the Congress. But at the annual clinical congress, there's a foundation lunch. And at the foundation lunch, we get to hear about some promising investigator who's accomplished something by the gift of the foundation. Is there anything like that type of lunch planned during the virtual meeting? And because if so, people can access it later. If not, what's the plan for communication this year?
We decided not to have the luncheon this year and not to do a virtual luncheon because we did not want to interfere with the conduct of the clinical congress, which was the major priority. However, we are planning on a recognition for the Dramati's family so that they can be recognized as the Philanthropist of the Year, hopefully at the Leadership Summit in the spring of 2021, where we would have a recognition ceremony for them at that point in time, if it occurs in person, and potentially virtually if it occurs in a virtual scenario. So I think that attending that luncheon, people can face-to-face and personal communication is really important for people to understand the impact of some of the programs that the foundation supports. And so that when a representative, a person that has received that award, such as in the past, Melina Kibbe, Henri Ford, or others have made presentations at that luncheon, and people can learn about the impact. And so that's the main reason that we do it. And hopefully we'll be able to do it in the future because it is quite a nice event. I think the donors enjoy it, and I think the recipients of the awards enjoy it as well.
Yeah, and I can tell you as a lunch participant, merely benefiting from the presentations, I enjoy those lunches. I learn what people have done and what incredible impact the dollars which we donate to the foundation make in the world for surgical outcomes. And I guess with that comment, I'll ask one last question, which is in the absence of a lunch this year and the ability to directly communicate, there's no foundation booth, obviously, at the meeting this year. What is your, as we might call it, elevator pitch to explain to our fellows why it's important to support the foundation?
Well, I think during the COVID pandemic, the American College of Surgeons has taken a gigantic leadership role in American surgery and healthcare, and really set the paradigms for dealing with operations, both non-emergent and emergent, in many of our hospitals. And I think that the efforts that have been put forth by the college have been supported in the background by many activities and volunteer activities of the leadership of the college, as well as continued support for ongoing programs. And this pandemic has made it more essential than ever for us to donate to the college and support its various activities. And I think that also, if you're going to the virtual Congress, you can click on the exhibit hall, and one of the first items that comes up is the ACS Foundation virtual booth. And you can go through the virtual booth, learn about the programs, read the annual report, which I would highly recommend, and you can make a donation. And it's very easy. And every dollar counts. Every dollar is used to support the college.
Unfortunately, unavailable, as in prior years, are the refreshments that are always in the foundation booth. So bring your own refreshments this time.
Yeah, bring your own coffee.
Well, thanks so much for all that you do as chair of the foundation. It is a very important college program. I'm proud to be a donor, and I encourage every fellow to support your efforts and the efforts of the foundation board to continue to improve surgical outcomes throughout the world. Thanks again for being with us today, Chris.
Dr. Wexner, thank you very much on behalf of the foundation board.